afternoon to all my wonderful audience. And I'm really obliged to be a part of this platform. In my life right now, it's almost 13 years of spanning career. I have worked with a lot of geriatric patients and patients specifically with chronic diseases like diabetes, hypertension, and heart diseases. And we have helped and encouraged a lot of patients in coming out of that myth that medicines are the only cure for these diseases. And we have really have made a major change in switching our patients from medicine to lifestyle modification. So that is very much important for diabetes. So as I may know that here in our audience, first I would like to know like how many people are diabetic or how many people are non-diabetic. So who are diabetic? Can you raise your hand? Okay, so I just wanted to know because as people are very much aware of diabetes nowadays, everything is available on the internet. You have videos, you have channels, and everyone is pretty much aware of what diabetes is, how does it work, and what are the medicines. So I would not be talking about medicines anymore because let's keep it an interactive session. I would focus on what is diabetes, what are the major types, and what kind of monitoring is required in diabetes, what are the types of monitoring, and early complications that may happen to the diabetes patient, which may go ignored. They will not be able to like associate them with the diabetic complication. They may think as it is a separate complication, but it may eventually lead to a diabetic complication. So if we talk about diabetes, now diabetes, not going into definition, we all know it's a condition where our pancreas is not able to produce insulin, or our body is producing insulin, but our body is not able to utilize it properly. So diabetes is a condition where in the bloodstream, the sugar levels will be high than what is demanded for your body. And it's like tremendous study has been done over the past 5 years in India for it. And 77 million people had been diagnosed with diabetes above 80 years of age, and mostly type 2 diabetes. And 25 millions are pre-diabetic, means they have not started on medicine, but they are on a verge that at a certain age, they will get diabetic. And 50% people, when we spoke to, they were unaware of their diabetic status. They did not knew they had diabetes. They came with some other complaint and we suspected diabetes. We got them checked and it came out with a diabetes. And we should also know that adults with diabetes will always have a higher risk of having a heart disease. Now, why is that? We will discuss that and how to take care of that. We have a lot of patients who are diabetic since 20 years. They have hypothyroid, they have hypertension, but they are fit as a fiddle. They maintain a very good weight. They have a very good physical quality of life. And they do not suffer from any other kind of comorbid diseases like heart disease or stroke. So first, in short, for the non-diabetic as well as for diabetic, signs and symptoms of diabetes may vary for different person. It cannot be same for everyone. In some patients, there will be weight loss, sweating, and they will not understand that their diet is enough, but the patient is losing weight. So they may not understand what exactly is happening. So some patient, they are diagnosed diabetic at a certain age, but there will be no weight loss. Patient may feel thirsty again and again. You will have a tendency of going to urine and again. But here also I want to say that it doesn't mean that person who is feeling thirsty all have diabetes. So these symptoms vary from person to person. Sometimes patient with diabetes will not at all have any symptom. That kind of patient also we have seen. They will just come with the report as a routine checkup and we will be surprised to see highly elevated levels of blood sugar. And we ourselves will be surprised and they will say we have no symptoms. But eventually we will see that their vision is less. We'll get them checked from the ophthalmologist and we will see that there is changes in the retina due to diabetes. But there was no other symptom in the body. And patient may have oral infection. In the mouth, they can have fungal infection, candidiasis, or otherwise the patient will have no symptom. Or otherwise we can say that patients are so busy with their life that they will ignore the minor symptom, and at last they will come to the hospital with some kind of complications. So this is what diabetes signs and symptoms is all about. Now, if I talk about diabetes, just a smaller thing for just an understanding. Now, in a healthy person, what happens? We have a pancreas, which is an organ in the body which produces insulin. So normally that insulin is produced at a normal rate. When we eat food, the food will go to the stomach. It will get breakdown into glucose in the body and goes to various organ, muscle, bloodstream. But the insulin is already ready from the pancreas. So as the glucose will release into the bloodstream, the insulin will start acting on the glucose and will break it down into simple sugars, and also it will keep the blood sugar into the normal range into the body. That occurs in a normal individual. Now, there are two major classifications of diabetes, which you might have heard again and again: type 1, type 2. Now, type 1 is normally seen in a younger generation people, because in these, there will be some immunity problem in them, where their body cannot produce pancreas insulin. So the normal insulin is not being able to produce by the pancreas, and the insulin is not being released into the bloodstream, or into very low dose it is being released. So whatever glucose is coming in the body, it is not getting broken down because there is no insulin in the body. So there will lead to high blood sugar. So this is a condition when the doctors say insulin is the only treatment, because body is not producing insulin. Now, type 2 diabetes, which 70% of the people suffer from. In that, pancreas is producing enough insulin, but our body is not able to utilize that insulin to break down the glucose. Why? It can be due to various factors. Sometimes if a patient is very overweight, the muscle mass is very huge. So the secreted insulin is not able to act on that muscle, or able to act on a very small area of the muscle. So all the glucose is not breaking down. Sometimes it is sedentary lifestyle, because our body becomes resistant to the effect of the insulin because of our diet, sedentary lifestyle, smoking, or not able to reduce weight. So type 2 diabetes is the one where we need more intervention. We need to educate people how we can control it, and we should clear the myths around it, that it's no more a dangerous disease. It's a disease which can be very well controlled with proper education and proper training to the people that what needs to be done. If I talk about risk factor, now it was very kind of surprising for us when there was 2 years of COVID. In that 2 years, we had a batch of diabetic people who we were treating since 2 years. Suddenly a batch came in that everybody was 28 or years older than like 28 or over age group of people, and they all were coming with pre-diabetic range of blood sugar. Everyone. Somebody had family history, somebody did not have family history. So that was a surprising trend that we saw, that people in the younger age group also, they are coming with pre-diabetic range of blood sugar. The reason behind, because in 2 years of COVID, there was physical inactivity. People stopped going to office. They were totally locked inside the home. And when you are inside the home, a person has a tendency of munching and eating food every hour or two, and no physical activity like walking, exercising, going or doing anything. That lead to sudden increment of these young age people who started coming with diabetes, which clearly proves that diabetes is no more a disorder which is inherited. It is a disorder which is due to your lifestyle pattern. Now, some risk factors are modifiable. We can modify this risk. Physical inactivity, we can do by 45 minutes of brisk walking. But for specifically geriatric age population who are 50 years or older, physical activity is sometimes a challenge for them, because I have a lot of geriatric patients who have a knee surgery done, who have osteoarthritis, who are highly overweight. They have difficulty walking. They cannot walk. So we do try to teach them on some aerobic exercises that they can sit and do. Aerobic exercise means those exercises which makes you sweat, which burns your calorie. So there is never a no to anything. There can be a lot of health conditions because of which you cannot do some activity, but some can be done. If you are overweight or obese, if your dietary habits are very much poor, a lot of junks in the food, a lot of alcohol, a lot of carbs, that needs to be cut down. If you have hypertension, that is high blood pressure, that also aggravates the diabetes mellitus. If you are a smoker, this also helps the diabetes not to be controlled and also leads to a risk of heart diseases. Some non-modifiable risk factor where we know that diet is going to help, but eventually the patient will need medicine, is genetic. Mother, father, both are diabetic. You are a single son or a daughter, 90% chances you will get diabetic. If you have a family history, certain race like Hispanics, Africans, Asians, they have a high risk of having diabetes after 45 years of age due to sedentary lifestyle. And certain pregnant women also get diabetes. And there are certain medication, like patients who have autoimmune disorders, like SLE, and who have autoimmune disorder like rheumatoid arthritis. If they are on medicine, which is called steroid, and they are taking it for long term, like 1 or 2 years, they are also at a risk of getting diabetic. Sorry. So if we talk about diabetes, what is the cutoff value? Many people comes with the report that my fasting blood sugar is this much. Why it is high for me and normal for the other people? That we need to understand. If you are already a diabetic, any blood sugar or HbA1c level that predicts the 3-month blood sugar of the body, if it is 6.5 and above, then you are a diabetic. But what is the target? What we expect? If you are a diabetic and if you come with blood sugar level of HbA1c 7, we will not consider to randomly decrease your blood sugar, because over the year, your body get used to that kind of blood sugar level. So never you should drastically reduce the blood sugar of the body with high-end medicine, because there is always a chance of hypoglycemia, that is falling of the blood sugar, low blood sugar and complication due to low blood sugar. If you are a pre-diabetic, means you are not a diabetic, you are on diet modification, the expected HbA1c is between 5.7 to 6.4. And if you are never a diabetic, then we will always consider a normal report to be below 5.7. So we have to see that which blood sugar levels is for you. So if a patient is diabetic and comes with a blood sugar level within 126 in the morning, I will consider that as normal. I will not do any random intervention into that. And if after the postprandial, after 2 hours or 3 hours after meal, if the patient comes to me and if the level is 200, then at that time also we will not do any intervention with the medicine. We will just try to modify the lifestyle and reduce it. But for different groups of people, these levels will be different. Because if you are a pre-diabetic, the fasting should be between 100 to 125, not more than that. And if you are a normal patient, the fasting should be below 100, not more than that. So these things we need to, and I have seen a lot of issues cropping up with the way the blood levels are tested. First of all, you should understand whenever you are doing the fasting blood sugar and postprandial blood sugar, the day before, you should eat at a proper time so that at least 10 to 11 hours have passed since you have taken your last meal, minimum 10 hours. Some people will have meal at 11 o'clock and give the blood test at 6 o'clock. That will not yield a perfect result. The blood sugar will come high because the time lapsed was not proper. So always remember, whenever you are giving your blood test report, there should be a proper 10 hours gap between your last meal and in the morning when you are giving your blood sample. After giving your blood sample, you should have your meal, and the time you had your meal, from that you have to count 2 hours, and then the postprandial has to be done. So there comes an error of the lab technician also, because they will take your fasting, they will leave the house, they will come exactly after 2 hours, but they will never bother to ask you, sir, when did you have your breakfast? They will just ask you, you had your breakfast? because according to them, their protocol is done. But for us, the actual report is that if the fasting was taken at 7 o'clock, and if the patient has taken the medicine and the food at 7:15 in the morning, so according to me, the postprandial should be taken at 9:15, not 9. 15 minutes will also cause a difference in the blood value. So we should always remember that whenever the technician is coming, you have to make clear that this is the time I had my food. Because postprandial is something we measure after the patient has taken food. What is the value of the blood sugar 2 hours after that? And until and unless your doctor has not advised, if you are a diabetic, you always have to take medicine along with your food for diabetes. And then after 2 hours, you have to give the blood sample. Many a times patient will come with high elevated blood sugar and they will ask me that, Madam, fasting is normal. I take medicine. Why my postprandial is high? Then when asking, they say, no, aaj blood test hona tha. That's why I did not take any medicine, madam. No, you are already a diagnosed diabetic. So in the morning, you have to take medicine, you have to take your meal, and after that, we need to check your blood sugar to see with medicine what is the control over your body. After taking medicine also, after 2 hours, if the blood sugar is coming high, then we need intervention with the medicine or change with the medicine. So these are the basic things which patient I have seen over my experience. There is a gap. And what do they do is with such high blood sugar report, they just go to the hospital, show it to the doctor. Doctor will, because as usual, in high-end hospital, there is a lot of footfall. So they will not have time to ask so many questions to the patient. They will just add 2 more medicines into that your sugar is not controlled. And again, you will be having 4 medicines in your list. But the gap or the loophole where it has happened, nobody we will able to identify that. So that's what's happened. Now, if I talk about monitoring diabetic, why is it important to monitor in a diabetic patient? Many people would encounter that your glucose level will be different at different time. For instance, a patient is taking diabetes medicine in the morning. Postprandial is completely controlled for that patient. But in the afternoon, one day he randomly checks, it is 250. He gets panicked. My blood sugar is very high. So this is a problem, improper dosing of the medicine, because there has been no monitoring of the blood sugar. We should monitoring the blood sugar in the initial phase of getting diabetic. That what is the blood sugar in the morning, afternoon, and in the night, before and after meal. So that we should know that the medicines should be placed during what time, afternoon, night, or in the morning. For instance, we are giving medicine in the morning, but we are not aware that patient has the highest hike of blood sugar in the afternoon. The medicine will not work on the patient. So that is very much important. Continuous monitoring of the patient and then deciding on starting the medicine according to the fluctuations in the blood sugar throughout the different times at a day. Now, blood sugar checks is also a very good idea when you are sick, because when you are sick or ill, you're not taking much food. You are taking diluted food. So at that time, the blood sugar may fall. So always remember, when you are sick, you should always not be taking the same dosage of medicine every day. If you're taking 4 tabs, it is not important you should take 4 tabs every day, because you should always monitor your blood sugar and then take your medicine. Because during sick period of life, it is expected the blood sugar to fall. And if there is any, or sometimes in some patient, if they're overweight, the blood sugar will show very high if they are sick, because there is no control over the food and they are totally sedentary. So always check your blood sugar and then have your medicine when you are sick specifically. Now, we know there are a lot of techniques of measuring blood sugar. One is the venous sampling. A phlebotomist will come to your home and he will take the blood sample from the vein. That is the most accurate. Apart from that, one is the glucometer test, finger prick test, and one is the CGM, continuous glucose monitoring. In India, glucometer is the most commonest because it is most feasible for the patient. Every equipment will have its pros and cons. If the glucometer machine is with you, you should make sure that the battery are replaced on time. Sometimes due to irreplaced battery, what will happen? It will show erroneous result, which can lead to a lot of complication. About the finger test, I think everybody would be knowing, because glucometer and how to use it, people are well aware of that. I'll be talking a little bit on the continuous glucose monitor. Like, what is that? Now, this is a technique which has been used, and in India also many hospitals do use, but these are the machines for people in whom blood sugars are not very good, nicely controlled. Means they are taking a lot of medicine, but the blood sugar is not getting controlled. The doctor is not able to taper the medicine over the past 4 months. He's not understanding what is the pattern of blood sugar. So as you can see in this, a probe is placed on any part of your body, and the same glucometer like machine will be there. So the probe will keep on extracting some blood from the tissues below the skin, and it will be transmitting the data to the machine that every 10 minutes, 123, 145, this is the range that is fluctuating in your body. And whole data will be recorded in that machine. So it will give a trend of the glucose meter, that from morning till night, what is the trend of blood sugar. So it will help the doctor to start you on medicine to control it better. And in this, the best thing is that there are alarms for high and low blood sugar. So you can know when your blood sugar is really high and when you are undergoing an episode of hypoglycemia or low blood sugar. And these devices improves blood glucose control, because you can really minimize the time spent with high or low blood sugar. You know when your sugar is high, when your sugar is low. But this machine also has a drawback. This machine, if you check this machine report and one taken by glucometer, there will be a lag of 25 minutes. So they can show different report because your blood sugar levels change every 10 minutes. Secondly, depending on the trend of this machine, you cannot do a sudden change in your medicine. Doctor will anyhow advise you to get a lab tested report, and then only he will do a change in the medicine. So there is only one advantage of this machine, that initially, if the patient is diabetic and the diabetic is not controlled by medicine or very much poorly controlled, this machine can help to give a trend, that what is the blood sugar level at each part of the day, to help the doctor to taper the medicine accordingly. Now, we will talk about how to prevent complications with sugar. Now, sugar is one disease which can affect almost all organs of the body. In medical term, we tell microvascular, macrovascular, small organs also, big organs also. Any organ is not there which the sugar basically leaves. It takes into action all the organs, and within time, patient will have complication. Even though the patient who are taking medicines regularly, in them also over a year of 30 years, 25 years, some complication can occur, but it will be mild because they are well controlled with medicine. So we need to understand what are the complications and what can we do to avoid it. First is cardiovascular, heart. It's the most important. Any adult above 40 who is a chronic smoker, who has hypertension and diabetes since past 20 years, are at a higher risk of having heart disease. Because in hypertension, in BP, what happens is there is lot of deposition of small plaques of cholesterol in the vessels of the heart. So the vessels will become very narrow. So the blood will flow through a lot of pressure from that vessels, which creates hypertension, high blood pressure. So that will also not lead to equal distribution of sugar in the body. Because of that, the patient will consecutively have high blood sugar and in the end lead to some kind of heart diseases. So it is very much, and these are modifiable risk factor. So you will normally see that if you are a hypertensive, if you are a sugar patient, doctor will also put you on a cholesterol medicine just to avoid deposition of these plaques. And taking these medicines together is very much important. So many a times people will come that why I need to continue my cholesterol medicine. It is, even though my reports are normal, because above 50, it's a normal pattern in the body that atherosclerosis happens. Means small cholesterol deposits get deposited on the vessels of the wall. It is a normal process for everyone. And for hypertensive patient, it will happen more. So to dissolve that plaques, the doctor gives you the medicines for cholesterol and triglyceride. so that plaques get dissolved and the passage of the blood is not compromised throughout your vessels in the body. So we have to understand that cardiovascular outcomes in type 2 diabetes is the maximum if you are obese, a high weight, if you have a high blood glucose, and if you have a risk factor like smoking, sedentary lifestyle. So we need to work on that. We need to at least inculcate some 30 to 45 minutes. According to the Asian journal, what we say is 45 minutes of aerobic activity is very much important. It can be yoga, it can be breathing exercises, it can be swimming, it can be walking, anything which burns your calorie. So that is very much important. And diet. Diet is something which is very much important. So eating a lot of fibers only will not help you. The diet has to be a combination of both good and the bad cholesterol. Bad cholesterol has to be on the lower side. Good cholesterol has to be on the higher side. There are a lot of good cholesterol sources available in the market. If you see, if you're a non-vegetarian, there are some sources called omega-3 triglyceride. They are fish oil capsule, which you can take like every yearly for 2 months, which will help to build the good cholesterol. So it will immediately lower the bad cholesterol in the body and it is protective for the heart. If you are a vegetarian, that there are some seeds available in the market called flax seeds. So every day, 1 teaspoon, either in the powdered form or the roasted form, you can put in your food and you can eat it. So it will help to increase the good cholesterol in the body, which is very much protective for the heart. So these are the natural things that we can do. Now, how you will screen yourself? So yearly, once you're 50, make it a point of doing a ECG as a part of your checkup. Because if there is any hypertensive change in the body or in the heart, ECG will at least predict that. Echo only if there is some symptoms like breathing difficulty, you're climbing stairs, you're having a lot of breathing difficulty, you're panting, you're sweating. Echo is an important investigation there. And treadmill test if on and off you are having chest pain while sitting or doing some work on the left side of your chest. So these investigations are important only if you have a symptom. But I usually advise for diabetic patient after 50 years, whenever you get your annual blood check done, please get an ECG also done. So that will be very much a kind of a screening procedure for you. So the doctor can predict like what's going to happen. Now, if I talk about the kidney complications, kidney is the second most important organ which is affected by the diabetes. Now, if we talk about this, there is one, we can say that the medicines themselves affect the kidney and the diabetes also affects the kidney. We have a group of diabetic medicines that taking over the lot of period of time, you will see that it has a detrimental effect on the kidney. So that's why we always say that try to put yourself on minimum medication and most on the lifestyle modification so that you're able to fight this disease without much complication. So once you have diabetic, every 2 years, you should get your urine test done to check for ketone bodies. They are the bodies which is formed in the urine if blood sugar is very high. To check if blood sugar is being excreted out in your urine. To check if there is any infection, because diabetic patients do get a lot of urine infection. If there is high blood sugar in the urine, it gives basically the area for the bacteria to grow. Bacteria thrive in this kind of environment which is high in blood sugar. So you will get urine infection again and again. And our kidneys are made up of very tiny units called nephrons. It is a kind of tubule in the body. So over the years, high blood sugar will damage these tubules so that they don't work well. And that's why the patient get chronic kidney disease if their diabetic is uncontrolled. But we do have many patients who are diabetic since 30 years and they are completely fine. Their kidney profile is completely fine because they have a very good control over it. If we talk about, this is something I wanted to discuss because 70% of my patients come with a neuropathy complaint. Nerve involvement of the blood sugar. High blood sugar will lead to nerve damage, which is called diabetic neuropathy. Every diabetic patient for me, above 55 years, had come with one or the other complaint that, doctor, I'm feeling numbness or a tingling sensation below my foot while sleeping, or while walking, I do get imbalance, or I get cramps on my legs, the calf muscle specifically, because of which I'm not able to sleep at night, or extremity of hot and cold. They cannot tolerate cold weathers properly. So they will have issue. It is because their nerves are too much sensitive to cold because of the damage that has occurred to them due to diabetes. Now, these nerve damages are also of different kinds. Peripheral nerve damage, autonomic, proximal, and focal. Lot of complaints we will get on these nerve damages. It will not always be single kind of nerve damage. It will come as different complaints to us. One is autonomic neuropathy. It means the patient will have bladder or bowel problem. The nerve in the bladder and bowel, they have become weak. So the patient will void urine without knowing. Till they reach the washroom, the urine will get voided in their clothes. The stool, they will not have the consistency to keep the stool, hold the stool. That also get voided for some people. Some people will have chronic diarrhea. Whenever they will pass stool, it will be a loose stool only. They'll start losing appetite. They may vomit. Other way, it can affect your digestion system. In autonomic neuropathy, it can affect your bladder. It can affect your bowel. It can affect your eyes, and it can affect your sex organ, where the man can lose the erection. And also the women will have vaginal dryness. So it can affect their physical life also. So that we need to understand. Second is proximal neuropathy. Proximal means the patient will come with complaint in the proximal part of the body. Proximal we call as thighs, hips, buttocks, legs. These organs of the body, they will come with pain there, shooting kind of pain, which will be localized to one area only. So these are proximal neuropathies. These are also sometimes people have come with this kind of pain, and on investigation, we found them to be diabetic with very high blood sugar, and no other effect had been there in their body. So this is also some of the symptoms we see. Focal neuropathy. Focal means difficulty in vision. You will have pain behind the eye. There can be numbness or tingling in your hands and finger. And there can be Bell's palsy. Bell's palsy, you know, there is a paralysis of the seventh nerve of the face in the body, because of which one side of the face will droop because they are weak. So these are some neuropathies which we encounter normally. If we talk about a very important aspect of diabetes care is the foot care. If I am not wrong, 90% of my people with diabetes will come with some kind of fungal infection in the feet, specifically women, because they are working all day doing household work, and they have a lot to work in water, and the fungus grows in the water. So they will come with itching between the webs of the toe, and they will come with infection which does not heals, and it becomes deeper and deeper. So for a diabetic patient, it is very much important to take care of their feet. If you're a diabetic, if you have a problem or a disease in your feet, you should check your feet every day. If there is any redness, any cut, because a single cut in diabetes can flare to a big infection in only a week's time if your sugar is not controlled. You have to wash your feet every day before sleeping with warm water, not hot water. Hot water, diabetic patients are very sensitive to. You have to dry them well and then sleep. Never go barefoot, even inside the house also, wear the good soles, chappals or sandals. You should wear all the time, because once you have diabetes, a lot of neuropathies, because of which you may get disbalanced while walking at home. So nice comfortable shoe you should wear, which fits you well. It should not be tight. Whenever you trim your toenail, always trim across and don't cut on the edges, because edges are the places where normally the toenail have the habit of growing inwards. Once it starts growing inward, you will get a big infection in the toe, which needs to be surgically removed. So cutting the toenail also is very important in diabetic patient. And any corn calluses, please don't remove by yourself. Consult your doctor, then only get it removed, because the doctor will advise you to give some medicine coverage so that the infection does not flare up. Oral complication, that is complication of mouth. That is something you can see in diabetes. You can have bleeding gums. Your tooth will decay very fast. Sometimes diabetic patient will say that I'm not able to understand taste of the food because the nerve in the tongue, they get affected. Sometimes there will be dryness of mouth, and sometimes there will be like white patches inside the mouth or your cheek. That is the fungal infection. So that needs immediate treatment. So you should never hesitate to reach out to your doctor or consider this as a minor problem. Hearing complication. This is very common in our patients above 65 years, because above 65 years, normally also patient will have a weakness of the nerve and diabetes aggravated. So normally we will find that the patient will have neuropathy in the ear because they are not able to hear properly in a normal volume also. They will want their TVs to be blaring at a very high volume because they are not able to hear. They will have trouble following the conversation of people. They are not able to follow it. And they will ask people to repeat again and again because they are not able to gauge what the other person is speaking. And they will be very embarrassed to tell someone to repeat it. And that we have seen in the elderly people. But there is nothing wrong in that. You should get your ear checked by an audiologist whenever you visit your hospital for a routine checkup. If you have any of these symptoms, there is nothing wrong in that. If the neuropathy is exceeding or increasing, always keeping a hearing aid for you is a lifesaver, because this can happen and that in middle of the road you're walking and you're not able to hear the sounds blaring behind you, the vehicle coming. So you should never hesitate to take help in these things. And eye complication is the commonest. I think people with diabetes at certain age do develop retinopathy because their nerves become weak in the eye, the retinal nerves, and it can lead to various kind of complication like blindness, dimming of vision. So the common eye disease is the leading cause of blindness in working age adult. We have diabetic retinopathy. The most common cause of retinal detachment in adults, it is diabetic retinopathy, because the high blood sugar will damage the blood vessel in the retina. And because of that, the blood vessel will become swollen, because all this is happening inside your eye. You may not know this. One fine day, you will feel eye pain. You will ignore, you will take some medicine. Within 2 days, the eye pain will settle because the inside the self-healing has started. And the self-healing, when it is happening, it will leak inside your eye. And after 1 week, you will find that your vision has become blurry. So this is what happens in diabetic retinopathy. That's why it gets unnoticed. People do not notice the symptom. So any eye pain you are having, blurriness of vision you are having, please get an ophthalmologist checkup done for you. So it is not very important for us to do it every month, but yearly once, the eye checkup is mandatory for any diabetic patient, type 1 or type 2. It has to be done. Any symptom, if you have blurring vision, if you find any dark spots floating in front of your eye, colors if you're not able to identify, green you're telling blue, you're not able to identify the wavelength, then you need to get your eye checkup. They will dilate your pupil through the slit lamp, they will look at your retina, and then they will share a finding, what is happening. And of course, diabetic retinopathy, at a stage, it becomes irreversible, but it is treatable. There are laser therapy available, photocoagulation available. Sometimes there are small surgeries called vitrectomy that can be done for the eye to heal. So you should not think that something which has happened, it is untreatable. Why should I go to the doctor? No. If it's in the initial phases, an intervention can be done. So please do not avoid. And screening technique for India, type 1 or type 2 diabetes mellitus, yearly screening of the eye is mandatory. You have to do it. And if any woman is pregnant with diabetes, then she has to go to the ophthalmologist as many times as the doctor prescribes. That is very important. Now, last but not the least, the most important factor associated with diabetes that I have been personally working on and working on people and counseling them, which they suffer and people fail to understand, is the mental illness associated with diabetes. 50% of people with diabetes will have mental health changes. They will get sad sometimes, tired, will not feel like getting out of bed, angriness. Sometimes they feel it is a burden to them. So much medicines I have to take. I have to go to hospitals all the time. They will not feel like. They will be confused. They can undergo depression. They will burn out fast. And they will worry all the time, thinking that some chronic disease is there in me. Now it is not going to leave me ever. So it will mentally bog you down. This is the place where we need intervention. In India, we see mental health and diabetes are never associated, but there is a link between the two, and this is ignored. That should never be done. For a diabetic patient, getting a counseling on time, understanding what is diabetes, how they can fight the disease, and how they can prevent the complication can lead to good quality of life, which people normally ignore. And we should always remember that there are 6 areas of improvement for a diabetic patient. You have to be healthful eating. I don't say that eat healthy all the time, but to my patient, I always explain that you are having difficulty to control over your eating now. But just think of a situation where actually you will not be allowed to take this food ever. So don't come to that situation. Try cutting down on your food, at least so that your blood sugar is controlled and you can take this food sometimes in a week or a month, rather than totally cutting it down from your daily lifestyle. Physical activity, very much important. For elderly, it has to be based on what kind of physical activity they can take. Managing stress, yoga is a very important part of that, and many people are doing it. It really helps to manage stress. Joining a club and talking to people, because elderly being normally alone at home, because my parents are retired, I know now they have nothing to do. So suddenly physical activity has stopped and totally they have become physically inactive. So at this point of time, joining clubs with people, laughing club, talking to them, talking about the diseases or talking about the positive thing, that is very much important. Then maintaining your good relationship in the society, not specifically with your kith and kin, but to people around you. Improving your sleep, that is very much important. With age, the sleep becomes very less for people. That you need to focus on. And cessation of tobacco in any form, whether you are orally taking or taking it through the cigarette. That needs to be stopped. So this is something which can help you to pave your way for a better health and for a better future. So that's all from my side. I can take questions now. I'll start with the questions. The first question that I can see is from Maya to everyone. That is, why is fruit advised for diabetics? Fruit has sugar. Yes, you are right. Fruit has sugar. There are different kinds of sugar. The sugar which harms us is glucose if you are a diabetic. Fruit has a sugar which is called fructose. They do not glucose will fastly break down into small particles or small sugar, we say, and it leads to elevated blood sugar. But fructose is a complicated sugar. It will not easily break down in the body. And we do not advise all kinds of fruits to diabetic. We are strictly against diabetic people taking bananas. We don't advise because it has a very high amount of fructose. But yes, fruits like guava, a slice of papaya, an apple, a diabetic patient can take every day because it has very less amount of fructose and high amount of fiber. And fruit is very important for our immunity. If we don't take fruits, the antioxidants will not be present in the body and the immunity will be deprived. So that's why fruit is advised for diabetic, but not every fruit. And also we should remember the sugar that is in the fruit is in the complicated form. So it will not suddenly break down into very small sugars, but the normal glucose will do that we get from carbohydrates. So that we have to remember. I think I'm clear with it.
Yeah, I think that's pretty clear.
Okay. Second, if hypoglycemia occurs at midnight, what should be done? That's a very good question. So my one aim is, what is hypoglycemia? Sudden fall in the blood sugar, which is very common with diabetic. So whenever a hypoglycemia is occurring, the diabetics are very much well aware that what is the symptom. They will have sweating, they will have dizziness, their hands will tremble, they will sometimes have difficulty calling someone for help. So for a diabetic patient, always keep a small bottle of sugar with water or a candies at bedside. All the time it should be there for such emergencies. Because if the patient wakes up in the night and find himself sweating and trembling, then this is a condition where he has to take 1 or 2 teaspoons of sugar with water. So at least the sugar levels will reach to that level where he is able to get out of bed, check his blood sugar from glucometer, and then take action. And whenever, if in the morning 4 o'clock, for instance, your blood sugar went to 60, you started sweating, trembling, you took a 2 teaspoon of blood sugar, after that you started feeling better. But don't think that the blood sugar may not fall again. This happens with people who are on oral medicines, specifically medicines like glipizide, glimepiride, gliclazide. These medicines, half-life is almost 8 hours. Means once you have taken the food, in 8 hours, they get half metabolized in the body. So their action will be up to 12 to 14 hours. So it can be that at that time the blood sugar has increased, but after 3-4 hours, again it will start falling. So you should be cautious. Once your sugar is fine, after 2-3 hours, you should again get your blood sugar checked. If it is again falling down, then you should not take the morning dose of your diabetic medicine and you should consult your doctor. And in a condition, it is for attenders or spouses of people who are diabetic. You find your spouse sweating unresponsive, just have a blood sugar check. If it is 45 or below, the patient can go into hypoglycemic coma. It is a kind of a serious issue, but not very serious. You will have time for it to treat. So patient means has gone into a very low blood sugar. The blood sugar cannot reach the brain. Because of that, the patient has become unconscious. Call for ambulance, because at that time, IV dextrose, which contains high amount of sugar, needs to be injected to the patient. So in this condition where the sugar is 45 or below and your spouse, your relative is not responding, call an ambulance, check the blood sugar, call the ambulance, shift the patient to the hospital, and they will get some injectable dextrose there and the patient may revive after that. So that you have to remember. Brown rice is recommended because it is supposed to be low glycemic. But to my logic, rice is rice, whether it is white or brown. Brown may be slower in being absorbed, but it's still rice. Yeah, I agree. That is true. Brown rice and white rice are rice. But yes, rice, where it comes from, there are different kinds of rice, the raw rice and the parboiled rice. So it has a very high carbohydrate. And compared to that, the brown rice has per milligram less carbohydrate than white. So people who are totally I specifically do not ask people to cut down on rice at all if they are diabetic. I ask them to take it in the afternoon, not more than one bowl of rice, brown rice or white rice also. So I don't specifically advise brown rice to my patient, that's for sure. I tell them you can take white rice, but it has to be in the afternoon and it should not be more than one bowl. If you feel hungry, substitute chapati along with that. But don't take rice at night, because if we eat rice at night and we just go after 1 hour and sleep in the bed, the carbs will be in high level in the body and in the morning you will have high blood sugar. So it's okay. Your logic is right. Rice is rice. But yes, brown rice has less carbs than white rice. That is true. When you say that blood sample should be taken 2 hours after breakfast, it should be made clear that it is 2 hours after you have finished eating and not 2 hours when you begin eating. Yeah, because once you start eating, that is also fine. Because once you have started eating, your body has come into the metabolic action. The blood sugar has started forming in your body. So that is a logic that normally eating breakfast will not take more than 5 to 10 minutes for a normal person. Only I'm not taking slow eaters into account. There are many people who are very slow eaters, but for a normal person, 10 minutes is the basic mean time that a person takes. So I think that will not make any challenge. If you are eating at 5:30, so you can tell the technician that I have eaten around 5:35 or 5:40. According to that, you can calculate and take my blood sugar. So that is fine. I attended a diabetes reversal course where we were told rice has a lower glycemic index than wheat flour or atta. We were recommended khapli wheat and in rice, brown rice and basmati. So that's what I told. The diabetic diet charts are being changed every day. When I had studied diabetes 5 years back, people were like, rice has a very high carb, stop it totally. When I actually went forward and I did a full-on certification on prevention of diabetes, I found out that atta also contains carbs. And rice does not have a lower glycemic index. That is wrong. There are different kinds of rice, even though the parboiled rice will have the higher glycemic content. But yes, atta also contains. So there was a condition when people started taking multigrain atta because it has low wheat in them. So that's what I say. I never support aggressive diet monitoring because carbs are also important for the body, even for the diabetic. If there is no carbs, what calories will you burn? But it has to be taken in a limited amount. If you're rice, we only tell those people not to take rice at all whose blood sugar or HbA1c is above 11 and it's not at all controlled. For them, we do the strict trimming of the carbs. Otherwise, for any person coming with us and who has a HbA1c level between 7 and 8, you can take rice once in the afternoon because you are physically active during that time, not more than one bowl, as I already said. Chapati you can take. Wheat flour also has carbs. You can opt for maybe multigrain atta, that you can do. Physical activity and cutting down on fried junks. Carbs are not only there in wheat or rice. Carbs are also present in a lot of vegetables, specifically vegetables which grow below the soil. Potato, which is a staple of Indian diet. I don't think there are hardly, in 10, I may find one people who does not like potato. Potato is the commonest vegetable cooked in any household. When nothing is there, we have potato. That is true. We need to cut down potato actually. That also I don't tell that don't eat potato. You can take potato maybe once a week or once in 10 days in a limited quantity in the afternoon. Vegetables like beetroot, turnip, carrot, they are also high in carbs because they are the vegetables which grow below the soil. So they always will be high in carb content. But vegetables like lady's finger, beans, ridge gourd, bottle gourd, the bitter gourd, you can take every day, anytime. So that will never harm you. I have one more question. Is it possible to get rid of medicines for diabetes? Sugar Fleet claim to get rid of diabetes, naturopathy. I'm strictly against Unani and Ayurvedic medicine. Maybe it's because I am a like allopathic doctor. But to be very frank, I have a 24-year-old patient. I had, in fact, sorry to say, who had switched to Ayurvedic medicine. And I don't know whether the practitioner was registered. I don't have any information about it. But he opted for the Jadi Puti wala treatment to get rid of diabetes, and he went into kidney failure, and he had expired due to that. So I have my personal experience, so I don't advise, because of course naturopathy is one kind of treatment. I don't challenge them. There are a lot of solutions, but if I'm giving allopathic medicine, I know it can affect your liver, it can affect your kidney. In what dose and in how many years? But in naturopathy, they will only talk about benefit. There will be no talk about the side effects. So that we need to consider. Yes, it is possible to get rid of medicines for diabetes if you are ready to work on your lifestyle and if you don't have type 1 diabetes. If it is a type 2 diabetes, inherited or due to lifestyle factor, you can control it. There are a lot of programs available. You can enroll in that, but it has to be a right program. Trust me, I have worked in Delhi before this, and I have found 28-year-old young boys getting affected with diabetes and kidney failure due to various kind of treatments they have opted for diabetes just because they did not want to take the allopathic medicine. So don't do that. Always it has to be naturopathy, according to me, is that treatment which comes from yourself. That is nature. Lifestyle modification, cutting down on bad habits, modifying your lifestyle, your food, that is the best naturopathy you can do. If you are able to do this, you have succeeded. How should sugar medicine be modified if one wants to do intermittent fasting? Now, this is a critical question that your doctor can advise. If you are my patient, first of all, if you want to do intermittent fasting, first I will see what is your fasting blood sugar, what is your postprandial blood sugar. Are you at a chance of going into hypoglycemia if you are fasting? And how frequent you should do intermittent. So that I will have to see over 1 month pattern of your blood sugar, fasting as both postprandial. And then I can advise you how many times you can do intermittent fasting or how frequent you can do. So that I can advise only if I know detail about your blood sugar level, at least for a month. At 8, flax seeds should be powdered for better absorption. Yes, flax seeds are very high in fiber. If you take directly 1 teaspoon, it will take a lot of time to get absorbed. What we do is we roast the flax seed, we powder it into the grinder, and normally the chapati which is being made, for my parents, I mix that in the dough. So that's a good way because you're not frying it, you're just roasting it on the tawa and eating it. So that's a better way to eat flax seeds. You can do that, even though you can take 1 teaspoon of powder with milk also in the morning. That also you can do. It's a little about low sugar condition and how to manage. As I have already shared it in the first few minutes, I'll just repeat it in short that if you have a low blood sugar condition, you should be aware of the symptom like trembling of the body, sweating, feeling dull, clouding of consciousness, you're feeling confused, people are telling you something, you're not able to gauge what they are telling. So you should understand that you are having low blood sugar. Even though if you don't have any hands-on glucometer at a side, you're outside somewhere, just make sure you eat something. High blood sugar is not that dangerous, but low blood sugar is the dangerous of all because the patient can collapse at that time. High blood sugar, you can have time for it to treat. But low blood sugar, if it happens suddenly, you can collapse in the middle of the road only. So if you don't have a glucometer, you have these symptoms, better sit at a place, eat some rice or some food so that some sugar builds in your body and you yourself will start feeling normal. You will feel, yes, I had low blood sugar and now I'm feeling normal. Another question I have, any words on alcohol consumption, which is most avoidable? Yes, of course I have. If we talk about alcohol, they are very high in blood sugar and also they contain a lot of triglyceride. They're responsible for fatty livers. To be very frank, alcohol affects your liver, and liver is one organ for breakdown of the blood sugar in the body. It utilizes the blood sugar from the bloodstream, converts it into a like a constituent called glucagon, and it stores in the liver. So this is also one organ which helps us to control the blood sugar. And once you start taking beer, whiskey, or any kind of alcohol in a lot of like regular basis, they will lead to settling of triglyceride into your liver. You will have fatty liver. It can be grade 1, 2, or 3, and it will impair the glucose tolerance in the body. So this is an avoidable situation. Once in a while, social drinking is not bad. The worst is, I think, rum and whiskey, which have a lot of alcohol content and it affects your body. So you have to be very sure of the quantity you are taking. So yes, it is an avoidable thing, and don't take it on a regular basis. Weekly once, if you, and weight control has to be there, your cholesterol needs to be controlled, and you should not have a fatty liver. If you have a fatty liver and you're still consuming alcohol, then it's high time you should taper it and stop it, because if you're a regular user of alcohol, it's not possible for you to stop it suddenly. You have to do it by regular tapering it. Okay, I have one more question. Sorry. Common myths regarding food. State a few. Some myths we have said that rice should be completely cut off. There's nothing like that. We can eat rice if you are diabetic, but it has to be taken in the afternoon in a limited quantity. Chapati do have carbohydrates. If you really want to cut down carbs, better switch to multigrain chapati, which will have wheat in a very low quantity and other grains like this all barley and all in the amount. And Fruits you can take in diabetes. There is no such we cannot take, but I have told you what are the fruits. That is apple, a slice of papaya, not the whole papaya, guava. These are the fruits you can daily take, and there will be no issue for you.
Hello.
So is IBS related to diabetes? Inflammatory bowel disease are of two types. The one is syndrome, one is the disease. So it is not exactly related. There has been various studies on this actually. But yes, the IBS, that is, I'm talking about right now only about the symptom. The inflammatory bowel syndrome, it do increases if you have diabetes. And I will tell you what is the reason for that. The most commonest medicine which is prescribed for diabetes is metformin. And metformin, when you take over a period of time, it has two commonest complications. One is the malabsorption of food, because of which the patient will have loose stool. They will not have a normal stool. Second, over a period of time, it can cause lowering of the vitamin B12 level in the body. That we call as megaloblastic anemia. So I think it can, there has been a lot of association and still it is going on. In US as well as in India, the ICMR is conducting studies on this. But yes, there has been a relation on patient in diabetes who are taking the medicine. And yes, secondly, as I told you about macrovascular complication, stomach is one of the organ which is involved when there is neuropathy of any kind. So stomach and intestine, they all have nerve innervation. So somewhere they can give symptoms of IBS, but not exactly. So I'm talking about only the syndrome. There is one inflammatory bowel disease. Under that, it comes two diseases, Crohn's and ulcerative colitis. That is autoimmune. So that is not related to diabetes. I'm just talking about the syndrome in which the patient will feel a cramp, feel like going and passing the stool, and the stool will be normally loose. So that can be aggravated due to diabetes. Yes, it can happen, specifically if you are on oral medication. People get heavy breathing and persist for a few minutes. They may not be related to diabetic, but if you have a heavy breathing and if you think it is in rest, not climbing stairs or doing some activity, and if your age is above 50, then please get a ECG or a echo done to see the function of your heart. There can be a cardiac involvement. Nothing to worry, but a screening should be done. What is your advice on reducing rice and shifting to millets? Will our digestion? Millets is very high in fiber. So there have been patients for me who has switched to so much high fiber that they have developed IBS. That's what also happens in diabetic. So don't be very aggressive with your diet. Be very gentle with your diet. Try to cut down those food products which are high in carbs. Carbs are important. You can take in small quantity. Take fruits in the small quantity and the advised fruits for you. Do lifestyle modification. Millets, of course, you can take, but don't totally reduce, stop the rice and shift to millets. You can alternate between millets and rice, but don't take that much salads and millets that you get an IBS, loose stool, and your digestive system goes out of track. That should not be done. It will lead to unnecessary weight loss for you. Any treatment for eye floaters? Eye floaters, if you are having, you really need to go to the ophthalmologist and get a retinal checkup done. It means that you have, so we will have to see how much retinopathy you have. We have two types of non-proliferative and proliferative. If it's a non-proliferative phase of retinopathy, treatments are available that your ophthalmologist will describe. Can diabetic people have sweet potato? Not at all. Sweet potato and potato, they both are high in carbs. You can have, if your sugar is very well controlled, in 8-9 days, once you can have in the afternoon in small quantity. That will not harm you. But I don't think any vegetables growing below the soil needs to be given that much importance. Thanks. Weakness while walking, it can be a sign of neuropathy. And if you are a diabetic, you need to, because I'm speaking on the background of diabetes. If you're not a diabetic, really you should visit a neurologist and get a checkup done for you. But if you are a diabetic and you have weakness while walking, please get your vitamin B12 level checked. If you're a vegetarian, these are the small things which we ignore. Vitamin B12 can come low, and if you have vitamin B12 deficiency, it can lead to neuropathy symptoms like weakness while walking, forgetfulness, tingling sensation in the legs, that you need to take care. Should we avoid wheat? No, not totally. You can take wheat in small quantity. If your sugar is well controlled, you can take pure wheat roti twice a day. There is no harm in that. What to do if I forget to take sugar tablet at one meal time? If you have forgotten to take it with the next meal. I would not, because it will depend. There are various types of sugar medicine, like metformin has to be taken with food. Linagliptin has to be taken with food. So if you had just forgotten to take and after half an hour you remember, you can take it. But if already 2-3 hours have been lapsed, don't take it in empty stomach. Better have some meal and then you can have it. And if your blood sugar is totally controlled, you can take in the next meal time. But if you're already suffering from high blood sugar, better take some like small brunch or meal and then you can have one tab. But the gap between 2 doses of medicine, if you're taking morning and evening, should be more than 10 hours, not less than that. Can I take fructose powder for my coffee and tea? Don't go for these all things. If you are a diabetic, better, because first they used to tell about sugar sweeteners like we get in the market, the artificial sweeteners. Then that also the FDA disapproved, saying that it contains sorbitol, that is more dangerous for the body. So right now the herbal formulation, that is stevia, which is most recognized. And right now in a trial of people who have been taking stevia, no side effect has been found. Or otherwise, please try not taking any sugar in the coffee if you can do. Or if you want to take some sweetness, if you are a diabetic, I think go for stevia right now. The studies are pretty good about it. Nothing abnormal we have found. My daughter is 49 years. She is diabetic and takes Manjaro injected once a week. What can you tell us about it? Manjaro right now is the newest medicine that is available in the market. These are the medicines which are normally taken in injectable form. And these medicines are basically, they work by increasing the insulin secretion in the body. May I tell you that medicines like Manjaro, they have been recently introduced into the market. And these medicines, only I think in these medicines, the group of medicines which they have, this is the only one medicine is which is orally taken. Rest all medicine is taken in the injectable form. And Manjaro, it has a composition of tirzepatide. So it is an anti-diabetic medicine and it is given to those patients also who have a very heavy weight, because it helps in weight loss. And a trial has happened and it has been found to reduce the weight of the patient, because it is not same with metformin. Metformin sometimes increases the weight or makes the weight the same. It does not have any change in the weight. But Manjaro have a change in the weight actually. So if your daughter is obese, the Manjaro is a good choice of treatment. And also it basically imitates the hormone, which will help the people to regulate appetite and they will feel full, because of which automatically they will eat less. So these are called GLP-1 analogs, glucagon-like peptide. As I said, the liver makes glucagon. So they substitute glucagon in the body. So the patient will feel full, automatically they will eat less, leading to weight loss and control of blood sugar. But still trials are being going on. If your daughter is taking injectable, make sure that every 6 months, along with the blood sugar test, she's checking her renal parameters, that is kidney function. So that is very much important.
Thank you so much for very thoughtful and well explained answers.
Thank you. It was very nice connecting.
Thank